All right, in this section, this is going to be the review questions and answers for the physics portion. You can use this for the CT registry or your CQR review. For question 1, which of the following controls the quality of the X-ray beam? You have your mass, your KVP, your HVL, and your beam hardening. Now I'll just give you a few seconds to just figure out the question, and then I'll give you the answer on the next slide. Which of the following controls the quality of the X-ray beam? You have your peak kilovoltage or your KVP, and this is going to control the quality of the X-ray beam and its ability to penetrate. So you have your higher KVP that is going to produce a greater penetrating power for your X-ray beams. And whenever you lower your KVP, it will decrease the patient radiation dose. And if I'm going too fast, you can always just slow it down or pause it or keep rewinding to look at the question, and it can give you more time to figure out the answer. Which of the following controls the quantity of X radiation that is directed to the patient? This time you have your half value layer, your KVP, your mass, or your bow tie filters. Okay, the answer is mass. So you have your mass that is going to control the quantity of the X radiation that is going towards the patient, and it can also influence the photon fluence. So that's what it's also known as. What is the typical range for a KVP selection in CT? Think about what KVP you normally look at whenever you are scanning. And if you don't know, the next time you go to work, keep in mind and pay attention to the KVP whenever you are scanning a head, a chest, an abdomen. See what KVP range it give you if you're scanning an adult or if you scanning a pediatric patient. So what is the typical range for a KVP selection in CT? 70 kVp to 150 kVp. So kVp, keep in mind, is going to control the quality of the X-ray beam and the ability to penetrate that tissue. Question 5. Which of the following is more homogeneous and is less susceptible to artifacts? Which one of these? Beam hardening. And it is not easily susceptible to artifact. Just keep that in mind. Beam hardening. The thickness of material that can reduce the intensity of the X-ray beam to 1/2 of the original value is called half value layer. Also know that it can be also called HVL. So when you think of half value layer, think of HVL, which is the thickness of that material that can reduce the intensity of the X-ray beam to 1/2 of the original value. Question 7. Which of the following is thicker at the ends than in the middle and can shape the X-ray beam? You have your beam hardening, your KVP, bow tie filters, collimator, bow tie filters. These are thicker at the ends than in the middle, and it can help shape the X-ray beam in order to reduce the radiation exposure to patients. So just keep that in mind. You have your penumbra And it can be defined as what? What is the definition for a penumbra? The unwanted extension of the cone-shaped beam. So penumbra is the unwanted extension of the cone-shaped beam. Pay attention to the question, the answer, the explanation. Whenever you are taking your test, whatever answer you choose, just stick with it. Do not change it. Question 9. Which CT generation scanner had two detectors and a collimated pencil beam of X-rays? First generation. Keep in mind this scanner was developed by Sir Godfrey Hounsfield, and it does have two detectors and a collimated pencil beam X-rays. Just make sure that you know all of your generations. Who created the first generation CT scanner? Sir Godfrey Hounsfield. He created this scanner and put it to use in 1972. And once again, if I'm going too fast, you can pause the video or you can go back and read the explanation or even the questions and answers, okay? The first generation CT scanner was known as what? You have rotate, rotate stationary, translate, rotate geometry. Translate, rotate. This is going to fall under that first generation CT scanner, which was put to use in 1972 by Sir Godfrey Hounsfield. So, like we were saying on the other slides, the tube and detectors translated across the patient's head, and then it did rotate approximately 1 degree. So that's why it's called translate rotate. The third generation CT scanner had what type of scanning geometry? Translate rotate, rotate, rotate stationary, or geometry stationary. And this is for the third generation CT scanner. Rotate. How many shades of gray can be displayed in CT? 128, 150, 256, or 350? Shades of gray. 256. So there are 256 shades of gray that can display 4096 pixel numbers. And this is for a CT. What is the term used for different shapes, such as a circle or a square, that can be placed over an area within an image, such as your abdomen, your chest area? What is this called? Voxels, region of interest, pixels, or your window level? Region of interest is the answer. So whenever you are doing your PE scans or you centering for or setting up for your aorta or any type of CTA, and you have to put that circle or that square, but whenever I put it, it's normally a circle. That is your region of interest. That's the ROI that you're placing. And it's going to provide a Hounsfield number. Which of the following describes an isotropic voxel? A voxel that has equal dimensions in the x, y, and z axis. So just keep that in mind. The ability to display fine details separately is called, is it called contrast resolution, voxel, spatial resolution, or pixel? What is it called? And it's going to be those fine details. Spatial resolution. So spatial resolution is the term that is going to be used to tell you the ability to be able to display those fine details separately. Which of the following can improve in plane spatial resolution? Large focal spot size, matrix, modulation transfer function, small focal spot size. Small focal spot size. You have your small focal spot size that is going to improve that in-plane spatial resolution. The ability to differentiate between two adjacent tissues of similar attenuation values is it called contrast resolution, spatial resolution, voxel, or matrix? Contrast resolution. So I will say contrast resolution and spatial resolution, it could be kind of difficult to understand and know the definition for each one. So when I hear contrast resolution, think about the adjacent tissues. How can you differentiate between the two? Or spatial resolution, those fine details. Spatial resolution is good for fine details. You have your contrast resolution that will give you the ability to see better or to see, the adjacent tissues, the contrast, the brightness. Any portion of the digital imaging system that does not contain any useful information is it called your spatial resolution, temporal resolution, noise, or matrix? And I'll give you just a moment to see. Noise. Noise is going to make the image appear grainy. It doesn't have any useful information for the image, so that's why we do not like noise because it's going to look grainy. It may make the images look like salt and pepper. It's not going to look as clear. The ability to freeze motion in order to provide an image that is free of blurriness is called contrast resolution, temporal resolution, pixel or spatial resolution. Temporal resolution. You can have the ability to freeze motion on the CT image, and it does not contain any type of blurriness. So when you think of temporal resolution, think of freeze. That's how I always just remember it like that. Freeze. Which of the following is a measure of the amount of desired signal that is compared to the background noise in a CT image? Spatial resolution, temporal resolution, signal to noise ratio, or SNR. And then you have your pixel. Signal to noise ratio. You may hear it be called SNR. As pitch increases, the speed that the patient travels through the CT gantry will do what? Will it decrease, have no change, decrease by half, or increase? And this time we're talking about pitch. So the key word here is pitch. It's going to increase. So pitch is going to be that ratio of the movement of the CT table. So whenever the speed increase or the pitch, the CT table will increase. To measure the CT scanner performance through quality testing and evaluating the test results, this is called what? Quality control, preventative maintenance, quality assurance, and uniformity. Quality assurance. QA measures the CT scanner's performance, and this is going to happen through testing the quality procedures and reviewing those test results. So when you see quality assurance, most of the time people is going to say QA. Did you run the QA phantom? Which the daily QA phantom is done, of course, daily. And sometimes if you work in a hospital, it may be done on night shift. But if you work in the outpatient imaging clinic, then you'll have to do it yourself because you are the only tech. So you may do it before you start your first patient if you work in the outpatient clinic. To provide corrective actions to improve the performance of a CT system, this is called what? Quality assurance, quality control, linearity, uniformity. Quality control. You may also hear it be called QC. So a lot of times people are either going to say QC or QA. QC stand for quality control, QA quality assurance. The reduction in intensity of the X-ray quantum as it travels from tube to the detector is called penumbra density attenuation or absorption. Attenuation. Attenuation is going to be when the intensity of the X-ray quantum is going to be reduced as it travels from the tube to the detector. Question 7. Linear attenuation coefficient describes what? What is the definition? The ability of an object to attenuate the X-ray beam. Which of the following allows the CT images to be displayed in different orientations than the one that is originally used? You have your rendering, your mini-IP, your multi-reformation or MPR, your surface rendering. This is going to be MPR. So whenever you are doing, let's say, a CT chest scan or a CT abdomen scan, if you are scanning a patient and let's just say you forgot to adjust your recons, maybe you forgot to turn it on and off, or maybe it was off and it didn't recon automatically, then you will have to go back in and just reformat those images, whether you need to reformat an axial image of the brain or a sagittal image. So whenever you go back in after you have scanned, and adjust the images. That's called NPR if you're going to adjust the orientational plane. Which type of images demonstrates contrast enhanced blood vessels the best? You have your pixel, your NPR, your surface rendering, or your MIP. Your MIP. So whenever you are doing your CTAs of your, let's say your brain, your neck, your chest, sometimes depending on your policy, radiologist preference, you have to MIP the images so that you can see those vessels and those arteries better. So this is what you're doing. You're MIPing the images. Which type of window setting is best for improving contrast resolution? A narrow window width, a narrow window level, a wide window width, a wide window level, a narrow window width. Which type of artifact occurs when an X-ray beam is capable of passing through an object? Motion artifact, beam hardening artifact, partial volume effect artifact, or metallic artifacts. So now we're talking about our artifacts. Beam hardening artifact. So whenever this occurs, it's going to be passing through an object, and it will appear as a light or dark streaking band on the image. When a structure is partially positioned within a voxel and the pixel value is not accurate, what is this called? You have your partial volume artifact, noise, beam hardening artifact, or metallic artifact. Partial volume artifact. Just be careful whenever you are doing this. You want to make sure that you um, position your patient correctly in the scanner, because anything that is not properly positioned, you can clip or miss anatomy. You can cause a misdiagnosis. So just make sure that you are doing the scans correctly. If you need help, don't be afraid to reach out or call some for help, because you don't want the patient results to be delayed or have to have the patient come back. Which of the following can be caused by peristalsis, cardiac contraction, tremors, or other involuntary conditions? Metallic artifacts, edge gradient artifacts, beam hardening artifacts, or motion artifacts? Motion artifacts. So the best way to control motion artifacts, if a patient understands clearly, you want to give them the instructions before you even start the scan. Let them know what to expect. Tell them, hey, we're looking at your abdomen. Verify the order. Verify that you are looking at their abdomen in CT. Tell them, hey, the machine is going to talk to you. It's going to let you know when to hold your breath, when to release your breath. You can practice the breathing instructions with the patient so they can know how to do it, especially if they do not understand. So you can also have the safety belt across them, or if the company for the machine provided chin straps or any type of straps, you can use those, but you cannot make up a strap. Like you can't use a sheet to tie down a patient's arm, because now you are restraining them and you don't have a doctor's order to do that. So just give the patients clear instructions. If they are altered, mentally altered, you can use a chin strap if you're looking at the brain or the head. Also, you want to use a safety belt regardless for everyone, because even if you have someone in their right mind, I've had someone tell me that it was their first CT scan and they didn't realize how high they was off the floor. So whenever the tech said they was done, they almost just jumped off the table because they didn't realize how high it was. So they could have fell, gotten injured, anything could have happened. But if you have a patient who absolutely cannot hold still and you see that there is motion artifacts, you can always try to repeat just a section if they just moved in like one section. But if they moved in one section, then it get good. Moved to another section, it get better. Then moved again, I would just repeat the whole thing. Put notes in stating that you told the patient to hold still or a patient is mentally altered. Question 36. Which artifact is caused by the CT scanner not being able to process a high spatial frequency? Metallic artifact, edge gradient artifact, motion artifact, partial volume artifact. So I'll give you a little bit of time to think about this. All right. Edge gradient artifact is going to occur whenever the CT scanner cannot process a high spatial frequency due to different attenuation values. Question 37. Surgical clips, dental fillings, jewelry, belts, and zippers can cause what type of artifact on the CT image? Motion artifacts, edge gradient artifacts, beam hardening artifacts, or metallic artifacts? Metallic artifacts. Before you start your CT scan, get a patient to take off their bra if they have one on for a CT chest, or if they have earrings in. I always get them to remove earrings for a CT head scan because you never know, it could be trauma in the area by the ears. You just never know. It doesn't always have to be in the head. It can be by the ears, where you're doing the base of the skull. Also, if you're scanning the abdomen, make sure they do not have a zipper in the way, a belt buckle. Sometimes you may train behind someone and they say, oh, the zipper is fine. I wouldn't take the chance, because if the patient is a hard patient to move over, if they are an ICU patient, if you work at a hospital, now you have to call the patient back downstairs, round up people who can help you move the patient over, or if they are an outpatient, they live for whatever reason 30 minutes to an hour away. Now you have to call them to come back. It's just an inconvenience when it only takes probably 10 seconds to tell the patient, hey, could you pull your pants down just a little bit, just mid thigh? That's all you have to tell them. And all right, let's see what we have next. Well, that's the end of this CT review questions and answer. It's free, it does not expire, so rewind it, review it as many times as you like to. Feel free to share with a friend, share with anyone who is preparing for their CT registry. Just in case you did miss, I do have these type of review questions for patient care and for safety. You can also go back and look at other CT videos I have. I have a CT registry playlist. I have a video on how to pass your registry, how to study for it. I have these different videos to help you all because I want you all to pass and succeed on the first try. So keep in mind the video doesn't expire. Questions are free. Go back and watch and rewind as many times as you would like to. You can also pause the video. I will say, um, do not focus on just the questions and the answers. Always read the explanation. Sometimes the explanation have more than what the question and the answer can give you. It will give you extra tips, extra information you should know, because you never know how the questions will be worded. So looking at all information is good. Going back, watching or reviewing my other lessons on CT is good. You can just leave it in the background. You can clean up and you can hear me tell you things in the background. You don't always have to sit at the computer. You can listen to your ears on the go or whatever. on your lunch break, whatever you need to do to pass. If everything went by too quickly for you, you can always pause the video. If the video is too long, you can always pause and pick back up where you left off at. So, other than that, if you found these questions to be helpful, please give it a thumbs up. If you enjoy these CT registry reviews, you can leave a comment. Also, if you have any questions, feel free to leave a comment. Be sure to hit the subscribe button if you want to so that you will not miss another lesson or so that you won't miss anything relating to CT. I hope you all pass your registry. Feel free to leave comments and let me know if you have any other questions. Thank you all for watching this review.